Friends, my name is Pratikya and I'm doing my clinical on the Portland Clinic located on Portland, Oregon. It is a family practice. Mm, Discussing about a case of a 65 years old Cajun female who was presented to the clinic accompanied by her husband. She's a reliable historian. For the chief complaint was she's been feeling more weaker and tired for the past couple weeks, and she's not even able to walk or to stand properly. So this case, like I have barely had a multiple sclerosis case in my clinic, but this case was like so interesting to me. This case started like, see, the patient had the multiple sclerosis diagnosed 15 years ago back in California. Back then she used to be in California. They have diagnosed her, gave her some steroid, treated her, did the MRI, did everything over there, and then she was treated. After she was treated, she moved back to Oregon, never had the symptoms ever. Still as a follow-up, she was followed up by the neurologist over here in the Oregon. Went to 3 different neurologists. Everybody just mentioned her like there is no more multiple sclerosis, and they did not even diagnose her with the multiple sclerosis here in the Oregon. She used to have like little bit of weakness and fatigue here and there, but not like she never had a flare up until past 2 years. So 2 years ago, she just had like a COVID attack. Then after the COVID, she started getting more fatigue, more weak, and then like weakness on her legs. Still she was okay. Like the neurologist still diagnosed as like post-COVID instead of her like MS. And then 6 months ago she lost her daughter because of the COVID. Like her daughter got COVID and then stayed with them for a while and then passed away with post-COVID. So since then she had a flare up, like excessive fatigue, excessive weakness, even needing a cane to walk, unable to balance the gait. And then so she's in the process of like seeing another neurologist, but in the meantime, like for the past 3 weeks she's not being able to stand, her legs are giving up, and then she can barely walk. She is walking but like not properly. Somebody has to be next to her because of the fall risk. So for her HPI, she's a 65-year-old female with a history of like 15-year history of relapsing, remitting MS, who present with a worsening fatigue on her lower extremity over the past 3 weeks. She reported of having difficulty walking and occasional balance issues, stating she has to rely on her cane now, which she was not using it before. So she denies having any bowel and bladder dysfunction or any cognition changes. She reported that her last MS flare-up was like 6 months ago, which is mild, not severe, but for the past 3 weeks it has been more severe. She is currently on disease modifying therapy with the ocrelizumab, which is IV infusion every 6 months, which she started like 2 years ago. And now like for the past 3 weeks she's having so much fatigue that she's having difficulty performing her ADL in the house. So for the past medical history, she has a MS diagnosed 15 years ago, depression, which was diagnosed after she lost her daughter, osteopenia and hypertension. For allergy, no non-allergy. For the social history, she's a retired school teacher, lives with her husband, occasionally drinks some wine, no illicit drug. She's a non-smoker, and started walking with a cane for the past 3 weeks. For the family history, no family history of autoimmune disease. Her dad died at the age of 75 with MI. Mom is still alive. She's 88 with the hypertension and osteoarthritis. For the medications, she is taking that TMO, ocrelizumab, 600 milligram IV infusion every 6 months. She's taking amlodipine 10 milligram for her hypertension, sertraline 50 milligram per oral daily for her depression, and vitamin D3 2000 IU for her osteopenia. For her ROS was unremarkable except the neurological and MSK. For the neurological, she had a weakness in leg, balance issues, numbness in the left hand. She does not have any dizziness or vision changes or any cognition decline. For the MSK, she's having difficulty walking because of her leg weakness. She's taking the help of the cane and walking like slow and one step at a time. So, and for the objective, everything else is within a parameter except her blood pressure. Her blood pressure today was little elevated, 140/88, which she reported of like she's always elevated. She's always on that side. So for her, it's a baseline, a little elevated from the parameter. For the physical examination, she was okay, alert and oriented for her general. For her neuro, her cranial nerve 2nd and 12 were intact. For her strength were 3/5 on lower extremity bilateral. Uppers were 4/5 on left and 5/5 on right. For her gait, she had an unsteady gait. She required the cane for support, and then she had difficulty walking heel to toe. For the sensation, she has a decreased sensation to light touch in her left hand, no loss of sensation in her legs. Reflection were 2+ throughout, and Badenski was negative. So other systems were fine. For the differential diagnosis, we can take like medication side effects from the IV infusion, which the most one of the symptoms is fatigue, and which she's been experiencing, but not like other. However, all the other symptoms are not associated with this one. The second can be like NMOSD, which is neuromyelitis optica spectrum disease. This disease affect the optic and spinal cord, causing the symptoms like MS, such as vision loss, muscle weakness, and sensory deficit. But in this case, like she's having more like a MS system, more like the musculoskeletal system, not the vision and cognition. Another diagnosis can be vitamin B12 deficiency, which mimic like MS, with manifesting weakness, numbness, difficulty with coordination, but it's more like demyelination of spinal and peripheral nerve. But it is more than, it's like B12 deficiency is more nutritional than autoimmune. It can be ruled out, and her B12 level was totally okay. So, and the final diagnosis we have chosen for this patient was relapsing remitting multiple sclerosis, based on her worsening fatigue, weakness, and then possible relapse or progression of MS, especially she's having all those symptoms and they are getting progressed. For the diagnostic, we are doing MRI of brain and spinal cord to rule out if we can find any lesion, plaque, inflammation, or demyelination. And then we can also do the lumbar puncture to test for like oligochemical bands, OCBs, in a cerebral spinal fluid, which is a hallmark for MS. And we can also assess like evoke potentials to assess the electrical activity in the brain in response to the stimuli. And for the treatments, we can do like a disease modifying therapy, which is we can still continue doing the ocrelizumab, which is a monococcal antibody every 600 milligram every 6 month IV. We can also start her on like corticosteroid, prednisone, a tapering dose for her flare up, since she's having like worse symptoms for the past 3 weeks. And we can also do the symptoms management, like we can start baclofen 5 milligram for muscle spasm, gabapentin 100 milligram TID for like neuro pain. For unsteady gait, we can always start a physical therapy, which will help her for her balance and strength. And like for the educational, we can provide the education regarding disease, especially like after having a multiple neuro. The family and the patient has thought like the MS will never come back, but since like it's relapsing, we can educate the patients regarding MS, its progression, and the importance of adhering the treatment. Lifestyle modification can be a great help in treating the MS, like importance of exercise, balanced diet, stress management, and especially adequate rest. And the other thing we can focus on is like a fall prevention, which is one of the most important thing to discuss about regarding fall prevention strategies, since she's getting like more weakness on her leg and having an unsteady gait. We can always talk about like fall prevention. Maybe like she can have somebody next to her until like the disease started getting better. Uses of cane again, like can be helpful on preventing the fall. And for the follow-up, we can refer her to the neurology doc again, like a regular neurology, to monitor the progression and the treatment adjustment as needed. And annual MRI scan are suggested to monitor a few lesions and assess the disease progression. So the clinic has is using like UpToDate as a guideline, and all these treatments method were found based on the guidelines from UpToDate. Thank you.